thinking about, reflection or mentalization or mindfulness or whatever terms you want to use into also thinking about what's going on in the body. We sometimes try and talk about, how is it in your heart, how is it in your mind, how is it in your body, helping people to tune in, to think about basically beginning to make links between what's going on the inside and what's going on the outside. The inside being any kind of internal experience, including the body, and the outside being what we can all see, what's observable behavior.
One of the things that I was thinking about when I was reading this about, the interchanges, the physical interchange between mom and infant, when it happens in a smooth way and they adjust to each other. I ended up thinking about, is this a precursor to mentalizing versus mentalizing?
Consciousness of the thing. We relate to each other as if we have minds. That's the leap. And once you are doing that, nothing's the same. So you're relating to your baby as if they have a mind. Whether you're talking about it, consciously thinking about it, it's just built in the same way we operate according to the assumption that there's gravity.
I think largely our port of entry as clinicians is at the explicit explicit and declarative level. And we can help people to tune into their bodies and to know what's going on. But in terms of the interaction that they're having with another human being that's in their life, we're thinking with them on the explicit level. We may be interacting with them on both the implicit and the explicit level, but we're thinking with them on the explicit level, and then hoping that they can take that into their experiences and somehow it affects it.
But it arises from anxiety, or it arises from frustration.
Or we don't know exactly. It could be physical pain.
But it arises from something. There's some stimulation.
Internal or external.
Right.
I mean, I guess I'm sort of interested in some of my clinical experiences. I used to work with some adolescent moms, and some of them were actually really wonderful in terms of this physical interaction.
Yeah.
And they were adjusting to the baby's position, and they were physically they were in tune. But once the child got a little bit older, they have no mentalizing capacity, and so it's the discontinuity that's sort of interesting. Now, is it the same or is it something different?
These two sort of paradoxical qualities of connectedness.
It's paradoxical.
It is paradoxical. I think it's paradoxical. The interconnectedness and the separateness, right? That our minds are at once interconnected, especially between a parent and a child, but even just in this room on an intersubjective level, we're having a connectedness, yet they're separate, and one doesn't blot out the other. I do think it's harder to mentalize when you're really when the attachment system is not secure.
Right.
But if you think about attachment, like the way Bowlby talked about it, fear.
Right.
Stimulates the attachment behavioral system, which leads to proximity seeking and comfort, and that the caregiver. And if you think about it as a parent or a therapist or a partner, that when the other that's coming toward you distressed, it's harder to maintain that capacity to think and reflect. But isn't that what secure attachment is? Oh, no, I wanted to have a dialogue, absolutely. That was the goal.